Okay, class, this is Intro to Anatomy Part 2. We are going to be looking at anatomical directional terms and body planes in this video. So make sure you have your worksheets out, your lab guide, and your lecture notes so you can follow along and keep up. So let's get started. Directional terms. You will see these terms throughout anatomy the whole semester. They are used to describe where the body parts are located relative to other body parts. What does that mean? We'll go through this one step at a time. So there are 5 different directional terms you have to know. First one, real easy. Anterior, aka ventral. Ventral is the same thing as anterior. And then the other term is posterior, aka dorsal. So here we have an anterior view of our man in the anatomical position. Anterior, aka ventral view. Here we have a posterior, aka dorsal view of our man. So this area would be the ventral surface. The backside here would be the dorsal surface. If you forget what dorsal means, remember all fish have, or a lot of them do, have a dorsal fin on their backside. So dorsal fin, backside. That part's easy. Next terms we're going to be using is a body part superior or inferior relative to another body part. So superior on top, inferior below. First, we use superior inferior directional terms only for head, neck, and torso parts of the body. So let's see how it would work for the head. We would say the nose is what relative to the mouth? The nose is superior to the mouth. The mouth is inferior to the nose. What about the mouth relative to the chin? The mouth is superior to the chin. The chin is inferior to the mouth. Let's go down into the torso. Here we have, this is trying to show you the sternum, the breastbone. The sternum is what relative to the belly button? The sternum is superior to the belly button. The belly button is inferior to the sternum. The sternum is inferior to the chin. So that makes sense. It'd be the same thing on the back side. Here's the back of the head. So remember, this is the occipital region of the head. The back of the head is what to the vertebral column. The back of the head is superior relative to the vertebral column. The buttocks are what relative to the upper back. The buttocks are the gluteal region down here. They are inferior to the upper back. Pretty simple, right? So that is superior and inferior. Now, for our limbs, when we're talking about our limbs, the upper extremity, the arms, and the lower extremity, the legs, we are going to not use superior and inferior. We're going to use proximal and distal. So here we have the knee, and here we have the ankle. You would not say the knee is superior to the ankle. Not correct. You would say the knee is proximal to the ankle. If a structure is proximal, it is closer to where it inserts into the torso. Remember, these limbs are inserting into the torso. So whichever part is closer to its insertion point in the torso, it will be the proximal one. What about the wrist relative to the digits, the fingers? The wrists are proximal to the digits. The wrist is closer to the insertion point up here than the digits. The digits are distal to the wrist. What about this elbow region? The antecubital region. The antecubital region is proximal to the wrist. The wrist is distal to the antecubital region. The popliteal region back here is what relative to the calcaneal region? It is proximal to the calcaneal region. It is closer to the insertion point into the torso. What about the upper thigh? This upper femoral region relative to the popliteal region. This region here is proximal to here. Make sense? So just remember, proximal and distal are for your arms and legs, superior, inferior for head, neck, and torso structures. And we're going to look at the next directional term, medial and lateral, on the next slide, I believe. Yes. So medial and lateral. So we're going to have, this is the median right down the middle. We drew a line right down the middle. The midsection right down the middle. So we would say whatever structure is closer to this midline is going to be the medial structure. Whatever structure is farther away from this median line, the midline here, it will be lateral. So we would say the nose is what to the ear. The nose is medial to the ear. The ear is what to the nose. The ear is lateral to the nose. What about the thumb here? Relative to the palm. The thumb is lateral to the palm. The palm is medial to the thumb. So we have our belly button somewhere. Oh, we got a belly button right here. Here is our belly button right here. The belly button is what relative to right here? The belly button is medial to this point. This point right here is lateral to the belly button. Here's our sternum, the breastbone. The ribs are what relative to the sternum? The ribs are lateral to the sternum. The sternum is what relative to the ribs? The sternum is medial to the ribs. And then we have some bones in our forearm here. We have this bone and this bone. We would say this bone is medial to this bone. And this bone is lateral to this bone. Pretty easy, right? Oh, now superficial deep. Now superficial deep, we use that a lot, especially when we are dissecting. If we are working on any organs or the cadaver, there are going to be superficial structures and deep structures. So the skin, the skin is the most superficial. Well, I guess the hair is more superficial than the skin, but the skin for the most part is very superficial. It's what's on the outside of you. It's covering you. We would say the skin is superficial to our muscles. Does that make sense? The skin is superficial to our skeleton. Our skeleton is deep. We have to cut through the skin to get to our skeleton. Our muscles are deep to our skin. Did I already say that? I don't even know if I did, but you get that, right? Let's have a look at another one. So here's a skull, and this is the top part of the skull. Remember we called this the cranial region? This is the cranium. The cranium is the part of the skull that holds the brain. So if we were dissecting and we had to cut through the skull, the cranium here, that would be the only way we could actually get into to see the brain. We would say the cranium is superficial to the brain. The brain is deep to the cranium. Make sense? Now let's look at this guy. So I think I want to make him a little bit bigger if I can. Now I screwed up my guys here. So here we have a model, and here we have the letter B. It's on this outer lip, this region right here of the outer lip. What would you say? This part of the lip is what relative to the tongue? C right here. I guess you could say the lip is anterior to the tongue, and the tongue is posterior to this lip, this B region of the lip. What about the A region of the lip? Could you say the A region of the lip is now lateral to the tongue, and the tongue is now medial to the A region of the lip? Technically, you could say that. But in all cases, no matter where you are on this lip down here, you could say the lip, this lower lip, is superficial to the tongue, and the tongue is deep to the lip. Same thing with the teeth. The teeth are deep to the lips. The teeth are deep to the lips. The lips are superficial to the teeth. So hopefully that makes sense, superficial and deep. Let's just go through some more terms here. We could say the sternum, the breastbone, is what to the relative to the heart? It's superficial. The heart is what relative to the sternum? It's deep. You've got to cut through the sternum to get to the heart. The heart is what relative to this lung? It is medial. The lung is lateral relative to the heart. That makes sense? This red blood vessel right here is what relative to this blue blood vessel? It is medial. This blue blood vessel is lateral to the red blood vessel. What else? This, we could say the liver here, this part of the liver is what to this part of the intestines. This is superior to this part of the intestines. This part of the intestines is inferior to this part of the liver. So now we're going to use directional terms, and the regional terms you already learned to describe the location of this leg wound. First, if you are working in the emergency room and the doctor says, "Where's the wound on patient in room number 6?" you would say, you have to describe this wound to him so he knows exactly where it is, just based on what you know right now. First of all, always remember, this is the right side. Oops. This is right. This is going to be left. You always have to say somewhere when you're telling them, is it on the right side or the left side of the patient? Always start with that. What do you know? You know that this is the distance from the wound to this region is 15 centimeters. What is this region called? This is the patella region, right? So you could say the wound is 15 centimeters proximal to the patella region on the right side. Or you could just say the wound is 15 centimeters proximal to the right patellar region. Either way, you've told them it's on the right side, it's proximal to the patella region by 15 centimeters. Does that make sense? And there's 2 other positions to know for clinically. You need to know these. A patient is either going to be in the prone position. You're finding them prone in bed. They're laying down, face down. Or the supine position. They're laying face up. Supine, laying on their spine. Easy to remember. So those are just other common body positions for you to know. So hopefully you got those directional terms. There's you have a worksheet, you can work on those. Make sure you get those down. Ask me any questions when we review this in our class Zoom sessions, so you make sure you understand what you're doing. Now we're going to go on to body planes and sections. There are 3 planes you have to know: sagittal, frontal, and transverse. These are all planes that are cutting the body or an organ in some way. A sagittal section is a vertical plane, is dividing the body into a right and left half. A frontal section, aka coronal section, is also a vertical plane. Vertical means up and down. It's dividing the body or organ into a front and a back side. And a transverse is a horizontal plane that's dividing the organ or body into a top half and a bottom half. So let's see what those look like. Sagittal plane. We said sagittal plane is a vertical plane. It's going to be dividing the organ or body into a right and left portions. If it is right down the middle, if that sagittal plane, that cut is right down the middle of your body or organ, we are going to call it a mid-sagittal plane. It's in the midline of the body or the organ, and it's dividing them equally into right and left sides. If it is a parasagittal plane, remember para means beside, so it's beside the mid-sagittal plane. A parasagittal plane is not midline, it's off-center. And a parasagittal plane is still dividing the body or organ into a right and left half, but they're no longer equal. So what do these planes look like clinically? And anatomically, you have to be able to identify these on any exam or quiz. So here we have our vertical plane. This is a sagittal cut right here. This is right down the middle here, so this is going to be a mid-sagittal cut, dividing the body into a right and left half. And this is what you're seeing on the inside. Here is a cadaver where they cut the body right down the middle, and you have a mid-sagittal cut here, and you can see the insides. This is what you're looking at. You can see this part of their anatomy now. Here's a model. They've cut, it's a vertical cut. It looks like it's mid-sagittal again. And here we can see the inside. We see half of the brain here, and we see the vertebral column and spinal cord here. So these are all mid-sagittal cuts right there. Here's some more mid-sagittal cuts. Here they cut a skull right down the center. And here is what it looks like on the inside of the mid-sagittal cut of the skull. Got half the skull here. Here is an MRI. They call this a sagittal section of this patient. Here's the nose, the mouth, the chin. Here's the brain up here. Here's part of the vertebral column here. So this is a sagittal cut. Now a frontal plane, aka coronal plane, it is also a vertical cut, vertical going up and down, but now we're dividing the body or organ into anterior and posterior portions. So here you can see they've cut right down in this direction, vertical, but we've separated the body into an anterior portion and a posterior portion. Here is a coronal or frontal cut through the head. So you are saying here's the eyeballs, the right and left hemispheres of the brain. Here's the nose. Here's the septum of the nose. Here's the tongue. So coronal section. Here is an X-ray. We can see the bones of the skull here. This is a coronal X-ray. We can see the eye orbits here. Here's the septum of the nose. So these are all coronal cuts, frontal cuts, dividing the organ or body into an anterior and posterior portion. Here's some more coronal cuts. So this is a total MRI of the body. We're seeing the entire right side, left side of the body. They've cut it so we can see, this is the back portion of the body here. Here's the heart. It has not been cut. If they do a coronal section cut through it, it's going to divide it, and here we have the back side of the heart. You can see into the heart now. So this is the heart. They took the front part of the heart off. Coronal section of the heart. This last plane that you need to know is a transverse plane. This is a horizontal cut, aka a cross section. So we are cutting in this direction, in the horizontal plane. So you can cut the body or organ anywhere in this horizontal plane. And now we are dividing the organ or body into a superior section and an inferior section. So what do these look like? Well, here's the skull. So if they did a horizontal cut, they now remove the top part of the cranium right here. And this is a horizontal, aka transverse cut. Here we have another model. Here's the nose, ears, eyes. Here's the back side of the head. They've done a transverse horizontal cut. We've got a top half and a bottom half. You can see the eyes. You can see both sides of the brain, the right and left hemispheres of the brain. This is what it looks like on a cadaver when they've cut through the cadaver. Here's the eyes. Here's the nose. Here is the brain. This is right and left hemispheres of the brain. Here's the back of the head here. So kind of cool, huh? Here's one through the abdomen. So here's a horizontal cut through the abdomen. These, I don't expect you to know what all these organs are because you don't know them yet. So here is a transverse or horizontal cut through the abdomen. And we are seeing the liver, the stomach, the kidneys. Here's the vertebral column in the back. So we have the front side, here's the abdomen, and the back side here, and the two lateral sides here. Here's an MRI. It's basically showing you the same thing. Here's the liver. We've got the kidneys. Here's the vertebrae right here, and we can see a stomach here. So this is an MRI. This is showing you a transverse cut through the abdomen. So you will need to be able to identify these on a quiz or an exam. Let's start with this one. We have three choices: sagittal, which is dividing the body into a right half and a left half; a coronal or frontal plane, which is dividing the body into a front section and a back section; and a transverse or horizontal cut, that's dividing it into a top and bottom part. So what is this? What kind of plane is this? Here we see the vertebral column. Here we see this is the abdominal cavity right here. Here's the liver, some other abdominal organs. But this looks like it's on a lateral view, right? It's a lateral view. This is a sagittal cut. I don't know if it's mid-sagittal, but it is definitely a sagittal cut. What about this guy? This one should be pretty easy for you. This is a frontal or coronal cut. So this is also a vertical plane, but it's dividing the body into a front section and a back section. What's this? This is a transverse or horizontal cut. Here's our two eyeballs. Here's the back of the brain here. Is the back of the skull here. Here's our nose here. Horizontal or transverse cut. Same thing here. What kind of cut is this? This is frontal, aka coronal cut. Here's a sagittal cut. Here's the vertebral column. And here is a transverse cut. So that's it for this video. I went on way too long, but hopefully do all your worksheets, and then it's going to be on to body cavities and abdominal regions and quadrants.